Good evening, everybody. Welcome to another episode in the Kennel Club's health webinar series. The Kennel Club has developed its health webinar series so that we can all hear from experts in their field and discuss really important health conditions in dogs. We want to share information, learn, discuss, and obviously ask really important questions. Where possible, our speakers do include real life stories, and we're more than happy to kind of look at real life stories and questions following as well. We're not here to offer individual advice though, so it's really important that you are registered with your local vet. We can't give individual veterinary advice on individual cases, so please understand kind of all of the information is within the context of research and within the context of breeds. Please always visit your vet with any concerns, particularly this evening. It's really important that you are registered and you go to a vet with your dogs. All of our webinars are now available on a playlist, the Health Webinar Series playlist on the Kennel Club's YouTube channel. So please go and have a look. This is our 11th webinar. So there's 10 other webinars on there on different content and topics around dog health. So please have a look and let us know what you think about that. Please be aware that you will not be able to speak during the webinar, and don't raise your hands because unfortunately we just don't have the facility to take questions live in that way. We will welcome questions at the end of the webinar. Many of you have already pre-submitted questions, which we will go through, but you can also use the question and answer feature, which is just in the top bar there. So without further ado, I'm really pleased to introduce Mark Dunning, Professor of Small Animal Internal Medicine at the University of Nottingham. Thank you, Mark. Over to you.
Great, thank you. Hopefully everybody can hear me. It's always a bit difficult with these things where you can't see anybody except yourself on the screen, but nevertheless, off we go. So the title is Can We Protect Our Dogs from Bloat and GDV? And I suppose this is really a wander through these conditions and trying to sort of pick out some things that may be relevant. It's quite similar to one that I did the other year, because actually, honestly, there's not a huge number of things that have changed. And so it's really just re-emphasizing the key areas to make sure that everybody's aware of this condition or these conditions and their importance. So I think the key things are, and this will be the content of the webinar, is that in order to protect dogs from these conditions, we've got to understand what they actually are, and that's as much for us and you as it is you. Vets need to understand more about these conditions in order to be able to help protect them in your hands. And I think despite everybody, well, most owners of dogs will have some awareness of bloat and GDV, particularly giant breed owners will know this very, very well. Despite them being very well-known conditions, we still have so many questions about how they develop. And so in terms of when we answer these questions or how we answer these questions, we still then have to think about, well, are they all relevant? Are these answers relevant to all of the dogs that we see these conditions in? And I think the answer to that is probably not. So we have to understand this disease from the bottom up, pardon the pun, because this is a gastrointestinal disorder. Okay, and to think of this as a gastric disorder, I think is where the shortcomings come in. Okay, and so what are we then going to review this evening? Some key bits. So we'll just go over what is a bloat, what is a torsion, what are the risk factors, what breeds are predisposed, and what should we do to stop it happening? Now, there may or may not be very good answers to each of these, but nevertheless, that's the point, isn't it? All of these things are key questions and answers that are really important for us to understand how much we can change about this condition. So what is bloat and why does it occur? Well, bloating pretty much refers to a stomach that's full of gas, usually gas. And so that is a bloated stomach. Now, the key difference between bloat and the torsion situation is that the bloat is where we're going to get a stomach that is not empty. Okay, so the stomachs can get bloated all the time. They empty and everything's fine. But actually, if we are unable to empty our stomach with gas, we are in a little bit of trouble. And that may be either end. It may be forwards as an irritation event, or backwards as you would normally get with passage of ingesta. So emptying the stomach normally is fine. If it's not emptying, we then start to get problems. But this is not the same as a torsion. Okay, a bloated dog is not necessarily a tors dog. It's just an opportunity for a torsion to occur. And so therefore, because bloat and torsions are not synonymous, it is an opportunity for us to then, if we can identify the bloated dog quickly enough and deal with that, then we can avoid the torsion. Okay. And I think this is the big deal. Bloating is rarely a fatal event, torsion can be. And so what do we mean then by the torsion? So this is, if any veterinary undergraduate or nurse undergraduate has this in their mind, when we first talk about how all this works, it becomes very complicated to try and work it out. Effectively, what happens when you look at the dog as it's lying on its back, or we think of ourselves, the normal anatomy is that the esophagus comes in on the left side of the abdomen and it moves across to the pylorus on the right side of the abdomen. So that's in on the left and out on the right. But what happens when you have a bloated animal and a torsed animal is that this all moves in the wrong place. So the bit that should be on the right moves over to the left, and then you get the bit on the left that gets shoved over a bit to the right. Hence, these areas that should empty are not able to do so. So this diagram that we've got here is a stylized way of looking at that, and we can see there that the pylorus that is sitting on the right in figure A is then all the way over on the left in figure D. Now that's still not very clear to sort of see. So what we've got here is a really nice video which I've pulled off of the internet, and is a really nice example of how this sort of works. So let me give you a go at doing. Oh, hold on. Oh dear, there we go. Technology. Let's try that again. Here we are. So here we are. So here's the stomach starting to twist, and we're seeing that thing that should be on the right and the left, and on the left on the right. And it doesn't matter how anatomically experienced or aware you are, it doesn't look quite right, does it, compared to how it started? And this is the picture that faces the surgeon as that abdomen is opened. And you can imagine doing your first, second, or however many torsion is never a fun event, because underneath that sort of lacy looking material there, which is what's called the greater omentum, you never quite know what you're going to find, and that might be a horrendously necrotic stomach, or it may be one that looks reasonably okay. So it's sort of a very unpleasant surprise in a lot of these cases. And so here's that diagram again, just to re-emphasize. And the thing we need to remember is that actually the torsion itself can be variable degrees of torsion. So that stomach can twist anything from 90 to 360 degrees. And as you can imagine, the more it's twisted, the more problems we see as a result of that twist occurring, because things are more abnormally positioned. Okay. So why then might we get bloat in the first place? Well, what is the anatomy of the canine stomach? So what is the normal dog stomach, and why does this sort of occur? Well, if we look at the two diagrams, these are sort of just drawings of the stomach. So on the left, at the bottom there, we see the sort of the way the stomach sort of looks, and it's sort of slightly funny shaped sac, where at the top we have an esophagus coming in, which is here. And then at the end, we have a pylorus. Okay, and both of these areas are controlled. Okay, so the entry and exit of material into and out of the stomach is controlled and needs to be tightly controlled. You don't want things coming back when they've gone down, otherwise you get reflux and heartburn. And then you don't want things then exiting the stomach too quickly, because they haven't been, the initiation of digestion hasn't occurred. And so both inflow and outflow from the stomach is very tightly controlled. And so abnormalities in either of these sites, as we can see in the top right diagram, what's called the lower esophageal sphincter and the pyloric sphincter, these two areas are those sites which we need to be working correctly in order for that stomach at any point not to become bloated or distended with material. Okay, and so this is a very carefully coordinated process, as though one might imagine that this is the process that needs to work in all cases, and probably has gone wrong in the cases of bloat torsion, such that these things develop in the first place. So what actually happens then? How does this bloating and then torsion actually occur? And that is that $64,000 question. And we're still not entirely sure. And this, as you can imagine, these are very difficult studies to do because you can't really induce bloat and torsions effectively mimicking what happens in the real world. So knowing what happened in the first place with these dogs when they come into you in fair extremis is actually quite challenging to pick out. So going backwards with some clinical stories is much easier than others, but going backwards with the torsed, half-dead dog on the operating table back to how it occurred in the first place, it's very difficult to take the time to do that because, as you might imagine, there are far more greater priorities that are occurring in theatre. And so actually, these next two slides, I think, are perhaps the most important of the presentation. Now, maybe not from an owner point of view, but from a veterinary point of view, and understanding how do we prevent bloat and torsions. Okay, so that's the name of this presentation, and it is a difficult thing, isn't it? You know, we are going to struggle to prevent this if we don't know exactly how it occurs. And so the problem here is that because some of these factors are not clear, it is difficult to know how do we technically reduce the development and outcome of these conditions when we're not sure which of these happens. So going back to those pictures that we've just seen of the normal stomach, as we said, we have a normal stomach in a normal position. Now, what we are not clear of entirely is whether or not we get a stomach that becomes dilated and then it cannot empty, okay, which moves us from the gastric dilation to the sphincter dysfunction, these entry and exit points. Mostly the eructation events, so this emptying upwards is what we tend to think is the problem with the gastric extension, or it may be that it's not going out in the other way, and actually the esophageal sphincter tends to be secondary, but we don't really know. And so what that then turns into is either a bloat or a torsion. So we can then move our way to the other possibility. From the normal stomach, we get a normal stomach which is unable to empty. So that stomach then becomes dilated, and then that can become either a standard bloat or it can be a torsion. And actually, we don't know in all cases which of those happens. And because we don't know, as you might imagine, whether this is a bloated stomach that triggers it or an abnormally emptying stomach that triggers it is quite important in terms of risk factors. Okay, so either we're looking for diseases which cause the ability to empty your stomach to be identified, or situations where the stomach becomes bloated are what we need to identify, and it's probably a bit of both. And this is part of that challenge, is getting rid of this problem, is our lack of ability really to understand it from the ground up. But there was a very, very good paper a little while ago now, which looked at what's the type of gas in the dog's stomachs when they've got an expanded stomach, a bloated stomach, and with a torsion. And interestingly, the stomach gas that was taken out suggested that the content was not room air. Now, obviously, this may have been changed over time, but nevertheless, the suggestion from this was that it's not due to aerophagia, okay, which then perhaps suggests that this is a sphincter problem, not a bloated abdomen problem. But this is a group of dogs in this study, so that doesn't suggest that it's all that case. But what this does do, and we're wheeling forward to some things that we're going to be talking about a little bit later, is are the aerophagic dogs the only ones that get bloat? And according to this study, absolutely not. So I think that then lends itself to understanding that aerophagia per se is not necessarily the thing that triggers this in all dogs. This may be a small cohort of dogs, but nevertheless, it's quite an important study. So what about the risk factors? How do these conditions develop in the first place from what we know from the studies that have been presented up until now? They are important, and we'll list those, but the key thing with all of this is preventing bloat and torsions is, well, of these risk factors, which can we easily change? And that's the all-important question, because the ones that are risk factors which we can never change they're moderately pointless to know about in a way, because you can't change them, you just know that they're there. So it's the ones that we can change that are all important questions. And I suppose analogous to that, and that's what we've been talking about, is that are these risk factors important in all dogs with gastric dilation, with bloat, or with torsions, or not? And I would suggest that this is not the case. So this is a condition or a syndrome where multiple factors in different dogs will play a role. So if we consider these as what I would suggest would be intrinsic and extrinsic, so those things that are internal to the dog and those things that happen to the dog or that the dog does. Okay, so the extrinsic factors are those things that the dog does or that happen to the dog. They're not an inherent property of the dog, i.e. it's got a certain conformation. Okay, and so these things are things such as environmental factors, so things that have been reported, okay, in no particular order and no particular importance in a way, whether they've been discredited, conflicted, or agreed in multiple studies. So things that have been talked about include diet, frequency, or the type, the composition of the diet, whether it's dried, whether it's soaked, whether it's tinned, whether it's small particles or large, how frequently these feeding or the dogs are being fed, what type of food, the type of or the composition of the food, how much fat does it contain, the suggestion being that that has an impact on how easy it is for the stomach to empty. Do we use a low-level feeding bowl or elevated feeding bowl? Do these dogs have some degree of after, postprandial, or after eating bloating events? Are they accumulating gastric gas for some reason? Do we exercise these animals before or after feeding? What about the factors such as ongoing or background gastrointestinal disease and changes in what we understand the microbiome, so that bacterial population that lives in our gut? Hugely important in lots of areas, and I think we're increasingly aware that this probably plays a role in dogs with bloat and torsion. Other comorbidities, things like appetite, libido levels, everything like that can impact on whether or not these conditions develop. There's some conjecture as to whether engorgement events have a similar outcome for dogs that truly have bloat, and that suggests perhaps that when you've eaten loads and it's expanded your stomach, unless the stomach has a problem inherently, it's not a big deal. Okay, so these are the things that we need to bear in mind. These slides are particularly for one question that we had emailed in beforehand, and so these are, fortunately, we don't see these much in the UK. I don't know if anybody's had dogs with these, but it almost makes you want to sneeze when you see pictures of nasal mites. So these are the nasal mite, which are prevalent in other parts of Europe and other parts of the world. And this has been reported in a publication from Norway as to being a trigger factor or a risk factor for developing gastric dilatation-volvulus, which is interesting. It doesn't change aspects in the UK, but what it does do, not being so flippant, it suggests that lots of things can lead to the possibility of developing this condition, which means there is an underlying susceptibility in some of these dogs where stuff that happens can trigger it. Because let's face it, most dogs that get nasal mites do not develop GDV. Nevertheless, in this cohort, those that did had more nasal mites. Now that might be that the rest of them were better wormed or use antiparasiticides. So ultimately, it's difficult data to interpret, but it's an interesting publication. I think this just raises that important point that there are multiple risk factors that can affect different dogs in different ways. And this is another publication just talking about how these things can conjecture each other. So this was a publication quite a while ago now, looking at the influence of diet. And according to this study, the diet didn't make any difference. I think we all have a suspicion that diet does make a difference. And I think diet probably in these cases is more impacting, not so much necessarily on the gastric emptying, but I think diet is playing a role in these dogs' long-standing gastrointestinal health, okay, which I think is very important in the long-term protection of these dogs from bloating and from torsions. So what about the intrinsic risk factors then, the things that are inherent to the dog that essentially we can't really change, not in that sense. So obviously things like breed, genetics, the size, the body size, not so much body condition, that is more controllable, the body size. The thoracoabdominal dimensions, so this is the deep-chested dogs versus the non-deep-chested dogs. Size and position of the stomach, laxity of the ligaments that hold the stomach in place, that control of emptying the stomach backwards, that irritation control, emptying the other way, the pyloric canal dysfunction, so emptying in the other direction. We know that relatives or dogs that have relatives that have suffered with gastric dilatation-volvulus torsions, they are at increased risk. There's also inherent factors such as temperament and happiness, so lots of things. Okay, so there's a huge variety, and I think a lot of these will become more clear perhaps over the years as more extensive studies occur within breed. And I think this is where, again, we'll come to this at the end, this is where I think we need to be very careful about making generalizations, because the breeds themselves, I think, have probably their own versions of bloat and torsions that we mustn't overlook and make a blanket recommendation. I think this is often the way with complex diseases, that people try and make general recommendations for all dogs, and they find that they don't work. And that's because individual dogs are more, they'll benefit more from certain recommendations, and we'll talk about that a little bit later. There are a couple of publications, or quite a few publications now, on the genetics and the impact of the microbiome. Okay, and so these publications predominantly have been in, or the studies that we've seen most work from have been in the Great Dane. And in these cases, we've seen that there are what's called changes in the innate immune system. Okay, and this is the immune system that it doesn't sort of develop over time. It's just what you're born with. And these genes here that were identified in Great Danes have some relation to humans with similar inflammatory bowel type diseases. And this was thought to be a link between sort of inflammatory bowel type disease, we call it something slightly different really now, in dogs, but nevertheless gastric dilatation-volvulus torsions and some degree of inflammatory bowel disease, which is fascinating. For me, has always been where my interest in this condition has come from, being a medic, is that there may be prime opportunities in these dogs to manage their perhaps unbeknown gastrointestinal disease and reduce the chances of things not moving in the right way. There's been another slightly wider look at in dogs that have had torsions versus those that haven't, and looking at small areas of genetic variation that may be different in those dogs. These things are just sort of really flags. They don't necessarily tell you exactly what to do about it, but they show that there are differences. And I think these studies are very interesting. They're also challenging to know what to do with until the dogs that are in the unaffected population have died. But that's a slightly bigger picture question for some of these studies on who does get it and who doesn't get it, and how the genetics are valid in each of those sorts of studies. But nevertheless, there are genetic factors now, or genetic changes that are being identified in these dogs, which are increasing our awareness that might increase the risk of some of these animals getting the disease. And we'll come to this again at the end, but this is where the sort of the genetics and the epigenetics come in. And this doesn't mean that all of those dogs with those abnormalities are going to get it. Okay, and that's a very important point. Now, these two papers, I think, are really interesting and really, really sort of exciting for the future. And these are looking at how do the gut bacteria influence the development of torsions in dogs. And I think we know that the microbiome in all sorts of sites is really important for health and disease. And we're increasingly aware that the gut microbiome underpins a huge number of both gut and more body-wide disorders. And similarly, we've seen in dogs with torsions, their microbiome is slightly different. And that's really interesting, because we know that dogs with what used to be called inflammatory bowel disease or chronic enteropathies are also affected by a slightly different microbiome, a less stable microbiome. So these are the sorts of things that provide us with the low-hanging fruit of how gut bacteria are not quite right, then much easier to try and change that than it is to fix the genes. Okay, and so this is why these studies are really important, is that they give us an opportunity. Okay, and this is all about opportunities to try and change an outcome. And we can't change, once a Great Dane's born, it remains a Great Dane. But if we can change some aspects about its chances of getting bloat, we may win, whereas we might lose if we're just trying to focus on the genetics. So what about breeds that are predisposed? So this was picked off a publication, and this is interesting stuff. And yes, it has the common animals on there, or common breeds on there, but it also misses a number of breeds off of that list, and that's often because they're more minority or minor breeds in the areas that these studies have been done. So, for example, Irish wolfhounds aren't on that list, and we know that wolfhounds suffer with bloat terribly. And so we've got to be careful about which ones are predisposed, and owners that buy a dog that is not on this list, that there is enough information out there that tells them from the breed health coordinators, which is, we're all trying to work with, that the new owner is not a naive owner with these sorts of conditions, because it's those people with lack of experience in these areas that fall foul of the not being aware of the time and the importance of these things being dealt with very, very quickly. So if we look at some of the outcome studies, the big deal here is that the overall mortality rates in a lot of these studies, and these are quite a while ago, some of these now, are between about 10 and 20%. Okay, so that's quite high, but nevertheless, that's based on older studies where a lot of the things that we might be able to think about doing now are perhaps people weren't aware of. But certainly, although this is a terrible condition, in these studies, a lot of these dogs will survive. But therein lies the problem in terms of which dogs are going to survive and which aren't, and how many dogs don't make it to these studies. Okay, so the OMR, the top line, overall mortality rate, which is basically coming in with torsion and going home again. Okay, and if we pick that apart, and if we look at the post-operative mortality rate, there's a bit of a variation here in the types of in each of these studies. Now, the trouble is we don't know how severe and how good these surgeons were, and that's quite important. Okay, so we don't want to miss those points. So we've then got the next line where if we've got a gastrectomy, so we're taking out the stubble part of the stomach, I'm taking out particularly how much of those things are going to influence outcome. And effectively what we see is largely these increase the chances of dying during that procedure. So ultimately, if it's more complicated, if there's more stuff to do for the surgeon, you're less likely to come out alive. Okay, and we'll come to that in a minute. So this is basically the quicker you identify this problem, the less likely we would hope or think that the surgeon have got a lot more to do. Not always the case, but certainly time seems to be of the essence. So, as we said, 10 to 20% mortality rate overall. But things like duration of signs pre-examination, i.e. before they get to the vets, time lag from when those clinical signs start to getting in to the vets, they need to be single figures. Do we have low blood pressure? Do we have evidence of these dogs having bacterial load in their system? Are they septic already? Do they have peritonitis? Is it really affected by this condition before they even arrive? Things like the gastric necrosis, so the dying off, parts of the stomach dying off, having that cut out, taking the spleen out, having heart abnormalities before the surgery. All of these we suspect have got something to play in terms of overall outcome. So these are a bit different to the does my dog get fed from a height or not? These are the things that actually are going to challenge the medics and the surgeons to get these dogs through their procedure. Now, whilst any of these increase their mortality, as we saw in that previous table, to about 30%, we did a study a while ago. This is where sort of a lot of interest of mine came from. This was one of my first project students at the university who wanted to look at bloat, and we did a study with Vets Now, which we presented at a conference the other year. Now, this was fascinating stuff. It was a retrospective study, so it's always very difficult to know what this means, but about 50% of the dogs with GDV were euthanized on arrival. Now, these didn't even get to theatre. So the stats in a lot of these cases in other publications where you're looking at the mortality rate for the dogs getting to theatre and out, a lot of these dogs haven't even been considered. Okay, so whilst the dogs that start treatment, their outcome is perhaps 80, 90% will recover, but those that arrive at the clinic, maybe half of those are never going to get past the consult room. And this is data that's really important to understand why. So what sort of factors affect the outcome? We sort of think that if you turn up overnight, you've got less chances of doing well, which is no surprise. Surgeries that take longer, again, no surprise. Whether a specialist or general surgeon is doing it, in some studies that seems to be relevant. I'm not entirely convinced that's always the case. Remember, where these studies are done, often biases who looks like they're better. If you took Fred up the road, who's done nothing but GDVs for the last 40 years in his primary care practice because he happens to just have 5 Great Dane breeds up the road, he might be the slickest GDV surgeon you've ever come across, but nobody ever knew that. So I think we've got to be careful about making the specialist surgeon the only one that's going to be able to do these procedures. Uninsured dogs 5 times more likely to be euthanized, and this may well be the reason for the data that we had, and that's really important. And actually, most of them are euthanized more at arrival than at any other stage in treatment. So how do we get the diagnosis? How do we recognize and diagnose a dog? So remember that there are various clinical signs. Now, it's almost impossible at home to determine between just a bloat and a torsion. So the bloated dogs will tend to be uncomfortable. Those with torsions will tend to be more uncomfortable because it's a much more significant problem that's going on inside. So they're often reported as vomiting but not bringing anything up. So they're non-productively vomiting, retching or regurgitating because they can't get things up into their esophagus because it's stuck in the stomach. Now, progressively expanding and tympanic abdomens are what gets reported. So the bloated dog is classic if you can see it. But remember, a lot of these dogs have got very deep chests and their stomachs can be very bloated before you even see anything. So you may not see it. So don't overlook it if you can't see the bloated area. Okay. A dog becoming very depressed, recumbent, unable to stand, pale, fast heart rate, very poor pulses, very fast breathing as well. All of those can be signs. Non-specific signs of pain. The non-productive retching, though, is one of those things that we need to make sure that we don't overlook that in these giant breeds, or particularly in the bigger dogs. And they're just sometimes a little bit restless. Sometimes these signs can be very subtle, but as a vet, we would always consider any giant breed that is being reported as being restless, particularly in an evening, that those dogs can't wait till morning to be seen. So what are we trying to achieve when we're managing these dogs with torsions? Remember, the bloated dogs tend not to be those that need a huge amount. We've got to restore and support the circulation because that's one of the main problems in these dogs. Because of the torsion, you disrupt that blood supply back to the heart and back to the rest of the body. We've got to decompress that stomach. We've got to understand whether it is a torsion or just a severe bloat. We've then got to correct it, and then we've got to stop it happening again. These are repeat offenders. Okay. So when should that decompression be attempted? So as that dog comes in, do you dive straight in to try and decompress that dog, or do you stabilize it? For me, you have to stabilize these dogs. This is all parallel tracks, really, but the dogs need stabilizing. If they are severely affected, you will lose your dog trying to get the decompression done if you haven't stabilized it. So we need to make sure that we do that. And there are a number of publications looking at rapid versus lengthy stabilizations, and there seems not to be a huge amount of difference in terms of how well these dogs then survive going to theatre. And we do know that shorter period of time between clinical signs and getting into theatre are important. So I think these rapid stabilization processes are probably certainly more advantageous. So then we've got to pass the stomach tube, and as a vet, everybody knows how to do that. You may need to give a little bit of sedation, which may be necessary. And it can be quite challenging, but a lot of these dogs are not very well, so it's not necessarily as hard as it would be when they're conscious. Now, in some time, if we're not able to advance the tube, don't keep forcing it. It's what the vets know, because we can end up damaging the area if we're not careful. If we can empty the stomach lavage, bloated dog then becomes very much more straightforward. But if we can't, then the torsion is definitely something that is on that list. Now, sometimes we can pass a partial torsion, achieving a partial torsion dog, but nevertheless, we've still got to understand where we're at after we've got this bit done. So we can, if we can't get a tube down, then we can then put in a trocar or a cannula into the side of the dog to try and empty it like that. Neither seems to have any greater significant complication rates associated with them, so that's fine. So in terms of if you can't get the tube down, putting a needle in is something that hasn't been associated with a much greater complication rate, because you think you might pass it putting a needle through into these dogs' stomachs. Well, that might cause horrendous problems, but it tends, as all of it's in the studies, it tends not to have been associated with that. And if we're trying to do that, we need to get a needle that's got enough gauge to it that's going to let out gas with bits of froth in them. So if we've got a small needle, if this dog's stomach is not bloated with fairly dryish gas, we may end up with lots of liquid and material, and so those needles can be blocked. So we want to make sure that we're using large enough needles to facilitate exit of all that gas and other bits. We tend to look at doing that on the right side, and we tend to do it where we can feel that the distension is occurring. And so, as that algorithm for us is, if these dogs come in, if it's a successful exit of stomach material, if it's empty, we'll always take a radiograph, whether it's empty or not, and that will give you an idea if everything looks like it's in the right place. Great, job done. If it's not, surgery. Okay, and so that you haven't fixed it when you've done your tube passage, because as we said, you can see partial torsions enabling a tube to pass. So radiography in all of these cases would be, for me, recommended to make sure that you don't discharge the dog with a partial torsion, only to get a full torsion 3/4 of the way home. All right. And so what else affects the outcome? Fluids, because these dogs are massively fluid depleted. Okay, and so we tend now to use fluids according to need in terms of blood pressure and mental status. And this is really to affect, and some of these dogs will require very large volumes of fluids. Some of these big dogs are going to need fluids that perhaps even greater than people do. So we need to make sure that we're adequately replacing their fluid requirements. And this is often using both front legs. And remember that the front leg veins of big dogs are pretty big, and we need both of those to enable us to be able to give fluids, to give all the medications that we require. So ultimately, these dogs need rapid and effective fluid management. Now, one of the big things that we know that the cardiovascular complications are significant both before and can be significant afterwards. And the big deal here is that the heart is suffering from reduced blood flow back to it because of what's happening in the abdomen. And what that does is, because you've got reduced blood flow, you're having problems with your heart maintaining its ability to pump properly. And as a result of that, the heart can't pump properly. It starts to get the muscle of the heart starts to become a problem, and it can then start to develop rhythm disturbances, which can be very, very dangerous. Okay, some of these rhythm disturbances before and afterwards can be fatal. And there's this thing called the R on T phenomenon, which is, it doesn't really matter too much for this evening, but what that means is what's happening there is that normal rhythm disturbances are where the heart beats, and it beats in a slightly different way, but that's often around about when you'd expect the heart to beat again. But with the R on T, what's happening there is the heart is being forced for various reasons to try and have another go at contracting before it's actually finished the previous contraction, and that's called the R on T phenomenon, and that's where we can end up with animals that will pass away from their severe rhythm disturbance. So we've got to make sure when we're managing these cases that the heart is being addressed. Okay, and that's that R on T. So if you see that on an ECG as a clinician, you're always pretty worried. So what about things that we might be able to measure? You're in the waiting room and the vet comes back and says, right, I've measured CRP and therefore we shouldn't go ahead. Or I've measured lactate and I think we're good to go. So these things are quite important, and people like new things to measure. We certainly do as medics and ECC specialists, like abilities to predict outcomes before we start or how well things are going. when you're administering your treatment. So things that have been measured in these cases would be CRP, lactate, CPLI, and procalcitonin. We'll come to those. So what about CRP and lactate? So CRP is a very sensitive measure of inflammation. Okay, it's what's called an acute phase protein. This is something that's been measured in dogs with GDVs, and in a lot of the studies that it's been measured in haven't really been associated with outcome, but we have seen it in a couple. Okay, so I think CRP is an indicator of how inflamed the situation is. Okay, and so you might think that it's predictive, but it isn't in all of these studies. So if your dog's CRP is really high, it doesn't mean that it's a bad idea to carry on because they're not going to make it. We don't have that data. Okay, lactate has certainly been, I think, is measured, and we understand more about what lactate represents in terms of fluid management and circulation. And certainly there is a suspicion that in cases where it's high and it doesn't go down with your fluid resuscitation, then it may be that the outcome is going to be less and less favourable. But in some studies, it isn't. But I think as a rule of thumb, lactate and CRP, they are markers of how bad things are for the animals. Okay, and we need to make sure that these are being used as part of multi-parameter measuring protocols, but we're not using them as gospel for not to continue. They are very good at assessing how well things are going, okay, in the cases they're used in. The CPLI is a thing that we measure in the blood that's associated with pancreatitis mostly, and there are a few studies that have looked at this now, and depending on what you read, the studies haven't suggested that there's a relationship to outcome. But nevertheless, it is increased in a lot of these dogs with gastric dilatation-volvulus. Now, that may be because the pancreas is really annoyed, but often the CPLI can take a little longer to come up in the blood than other measures of pancreatitis. So whilst this could be a reflection of complicated GDV, it also might mean that these are the dogs that have got background gastrointestinal disease. And this goes back to sort of managing these comorbidities that may be part of how we're going to reduce the chances of these things occurring again in the next setting. Procalcitonin is a good marker that people have used or that humans have that looks for infectious disease really rather than inflammatory disease. So this is a sort of parameter that we will measure with CRP. We don't have good validated procalcitonin commercially available assays at this point, but the idea is that procalcitonin and CRP both tell you about inflammation, but procalcitonin is better at telling you whether you've got an infection. And so not quite for this forum, but things like procalcitonin and trying to get that better understood may help us reduce our need to use antibiotics in certain settings. But nevertheless, procalcitonin doesn't seem to be particularly helpful at picking apart whether these GDV dogs are also septic or not, because there wasn't a great separation in the studies that we're seeing. But I think this is early days because we don't have many studies on procalcitonin as yet. But again, in the future, this may represent a very effective way of us trying to work out whether this is a dog that has a septic peritonitis on top. So what about the radiographs? So we said once you've taken your dog to try and decompress it, we then need to check whether it has just a bloat or it has a torsion. So there are a number of ways that this is picked out with the radiography, but it's to do with, are things in the right position? Remember, we've had the thing that was on the right shift over to the left and the bits on the left of the move to the right a bit. So effectively what we have here is the stomach dilated? Do we have that pylorus, which should be sort of in the middle of the abdomen? Is it on top and moving forwards? It shouldn't be. The classic is what's called the reverse C, or the double bubble sign. There's pocketed gas in the stomach, which shouldn't look like that. We can also see things like free air in the abdomen and free air in the stomach. Well, both of those suggest bad news for the dog. Okay. And so here's a couple of pictures. So this is the double bubble, as you can see, or a sort of reverse C. It's sort of a C shape. So the red arrow is the pylorus. Now that should be where the yellow arrow is sitting and going from the diaphragm here down to the bottom. So it's in totally the wrong place. Okay, and this is a classic gastric dilatation-volvulus picture. Here we have another one, similarly that double bubble or that shelf of tissue in between. Okay, and inside, as you might imagine, it's not looking very good in there. And so these are some pictures of dogs with their intraoperative appearance of the stomach. You certainly wouldn't want the one on the right. So why did this go wrong? Well, as you might imagine, as you twist your stomach, all of those blood vessels get disrupted. They tear, they get occluded, and that leads to sort of reduced blood supply to the stomach, which leads to reduced oxygen, so it becomes necrotic. And the longer that's reduced, its oxygen supply is reduced for, the more chance you've got of these dogs having a stomach that needs part of it or maybe all of it removed. And in those cases, they may not make a very good outcome as such. And we also get some clots in these vessels. So here we are. This is that sort of picture again in a slightly different form. We can see as we're stretching that area where that bit on the right goes over to the left, and on top you've got these areas of bruises because you're tearing these stomach vessels away from where they are coming out of those blood vessels in the abdomen to supply the stomach, and that's really bad news. Okay. And so as we've talked about the stomach, we then come on to what about the rest of the dog. And so we've said that the blood flow that should be getting back from the abdomen going into the chest and back to the heart doesn't occur. You've got this huge bloated stomach, so it just doesn't get there. And so then the heart, as we said, the heart's then trying to have to beat faster. It's having lots of problems, not only with these products that can change rhythm, but it also is beating faster when it's getting less oxygen, and that increases the demand. If you're beating faster, your heart's beating faster, you need more oxygen, not less of it. So that all then predisposes to even more problems with the heart rhythm and the heart muscle. And the heart is one of those main organs that we see problems with in dogs that have had GDVs, particularly afterwards. And so then in the rest of the body, particularly the heart and everywhere else, when the blood supply does get returned, you get what we could call reperfusion injury, and that can be quite severe. And some of these things that we can see will lead to a huge inflammatory response, and that can be the death of the dogs. So these things are pretty severe, okay, as we might expect. So what's the surgeon need to do? For me, a medic, the surgeons, you give it to the surgeons and they sort them out and they give it back to us to then try and keep alive. So they do their bit, which is no trivial undertaking, as you might imagine. So they've got to sort out the twist, and that's not easy. So they've got to understand how it's gone wrong, where it's gone, what bits need to stay, what bits need to go. And that's really important. And a good surgeon will know that. And that gives this dog the best chance. If it goes to theatre and comes out with all the right bits having been done, it has a much better chance of living at the end of it. But then we've also got to prevent recurrence. So the surgeon's job is also to sort it then and also reduce the chances of it coming back, because they are repeat offenders, as we said. Okay. And so don't take the chance twice or three times. We need to make sure that these dogs have a gastropexy, so the stomach then is fixed in position. Lots of ways in which this can be done. A list there: tube, incisional, circumcostal, belt loop, laparoscopic percutaneous, all sorts of things. But effectively in theatre, things like circumcostal belt loops tend to be the ones that are done. The incisional is one that's associated with the weakest fix. So this story about prophylactic gastropexy, it's been around for a long time. I think it certainly started in the States, and we now have this sort of thing that people are doing over here. Interestingly, the publications have looked at cost effectiveness. And I think if anybody's had a dog with a GDV, I think it's more emotional and empathy that we might be talking about rather than cost effectiveness, because stopping this happening, we know that dogs that have had a gastropexy it's almost unheard of that they get a gastric dilatation-volvulus, although certainly in that Vets Now study that we had, there were 2 or 3 that did get a repeat gastric dilatation-volvulus event. So that, and there are all sorts of reasons why that might be the case, but nevertheless, hugely reduced in incidence. Okay. Complications of doing gastropexy are relatively low. Prophylactic laparoscopic gastropexy, which are now one of the ways that these would be done, the complication rates are okay. There's maybe a 10% complication rate depending on what you read, but actually the outcome is usually okay, even though there's been some complication rates, and GDVs are, as we said, vastly reduced. So what about gastropexies then? So the key thing here is if you're doing a gastropexy, where do you put the pylorus? Where are you pexying your bit of the stomach? Now, I've done a couple of these a long time ago, and it's not easy to know. You sort of have a look at the inside of the dog's abdomen, you think, well, it should go about there, and do it and hope for the best. There's no little nubbin on the inside of the dog's abdominal muscles that says a fixed pylorus here. And there's been a very interesting study that was done relatively recently looking at well, not the gastric dilatation dogs, but in the normal dog, where does that pylorus actually sit? And it's very interesting. So, a CT study, and actually, you've got the variable position of the pylorus, okay? And 63%, what they said, 63% are positioned at the 8 to 9 o'clock position. Effectively, what that means is only just over half of where you might expect them to be. And also, the distance between the pylorus and the abdominal wall, remember it's on the right, this is the bit that goes from right to the left. There is a variation in the distance between the pylorus and the right abdominal wall, which is a really important point. We're talking about this gastrointestinal or gastric ligament laxity. Some of these dogs, it's not as tightly adherent or fixed towards the body wall, not stuck to the body wall. It isn't like that, but ultimately the distance does vary, and that's really important. Why? Because then does this mean that pyloric position in the first place predisposes to GDV? And actually, what it also means is if we then pexy the stomach, are we pexying it in the right position, or are we pexying it in the wrong position? Interesting study. As we said, this is the study that's done. It's a publication from a couple of years ago now, but it's a really nice one. But then we've got this thing about instability of the gastric ligament, which we've just been talking about, this position between the pylorus and the body wall. Various things that it's been called over the years, but essentially what it means is that in these cases, there's some suggestion that the stomach is a bit flaccid and abnormally mobile. And one might expect, therefore, that it's just not held in the right place in the right way. It's certainly a risk factor in people. So bloat and torsion or torsions is really unheard of in people. It's mostly sort of in children and geriatric patients, but the lax gastric ligaments are thought to be a major factor of it occurring. Various signs, gastrointestinal signs really, bit of bloating, bit of weight loss, not eating so well, occasionally vomiting. And so ultimately this is really important, is that some of these cases that sound like they might have inflammatory bowel disease might well be more of an anatomic disorder, and that's something that we might need to think about. And as we said, if we put the pexy in the wrong place, we may end up increasing the chances of some laxity and a torsion. Not easy, something that's challenging for vets to identify, but certainly something that we need to consider. Okay, and this is one of the publications on this relatively recently in a Great Dane. And there's also a publication in a very young Bernese Mountain dog, a while ago, 5 months old. You'd expect there's something wrong with this dog's gastrointestinal tract. It may be that it never eructated well, but this dog actually survived. So ultimately, it might well be that this is a case of lax gastric ligament. So, coming to the end, how do we best address bloat and GDV? So 2 pictures, okay. Now, the whizzy one on the right is what everybody wants to do, okay. As vets, and as owners, it's right, we're going to get the gene for this and fix it. It's a nice idea. The one on the left, that's the one that we really need to be targeting. Okay, there's short, medium, and long games, aren't they, with this? But ultimately, when we go back to those factors, extrinsic factors, the stuff that happens to the dog, they're the lowest hanging fruit. The intrinsic factors, don't try and eat the elephant, because if you think that the genetics of this are going to be easy, blimey, I think just from this evening's talk, we know that this is complicated. Therefore, to find a gene that we can do something about easily is really unlikely at the minute. Now, finding some genes which we may be able to do something about in the future, great. That's our point. It's not a pointless task, but directing our efforts to get a genetic cause and to breed it out in dogs we're nowhere near that. We're nowhere near that. So I think these have to be considered complementary. Okay, and that's really important. So the Great Dane studies, as we've already said, there's evidence that we have an association with inflammatory bowel disease type genetics. We know that their microbiome is wrong, but actually it's not in all of them. Less than 75% had these alleles. Therefore, they're not the only answer. And this is the thing that's always important when you see these studies that say, oh, there's 70% of these dogs with this disease have this genetics. Well, that means 30% didn't. And that's what we miss that. We miss that. And everybody focuses on, great, we've got the gene. Well, you have a gene or some genes that do some things that cause this condition, but there are others that we don't know that also do that. So we've got to be careful about what we don't know as well as what we do. And we talked about these little abnormal little genetic areas that increase the likelihood of getting a GTV. So these are the things that we know, but this for me is what this is about. It's a bucket, and I think medicine's often about the bucket of disease. So there are various factors in that bucket. We've got intrinsic and extrinsic factors, and each one you throw into the bucket, eventually the bucket spills over and stuff goes on the floor. So our goal as clinicians with owners involved is, how do we stop the bucket spilling onto the floor? So if 3/4 of that bucket is genetics, but 1/4 and the rest of it isn't, then we can stop that bucket spilling over onto the floor, leaving it 3/4 full. It doesn't matter how full it is, as long as it doesn't spill over. And the spillover would be what we would consider as being clinical disease. Okay. So what do the studies tell us? So we know that there are changes in genes. We know that there are changes in the microbiome. And most importantly, the lowest hanging fruit is the epigenetics. Okay, so what factors can we introduce into this situation which will either change the way these genes work or they change the outcome? Okay, and that's really important. Okay, so we need to impact the factors that we can control. So various bits here. So making sure people are aware of the signs and the actions. Okay, information resources for owners existing. There's existing stuff on this, and there's a bit of a work in progress. We've been working on this for a little while. I've got a student that's coming up with various bits. So what we have at the minute is that it's, because everyone has to come up with a fancy acronym, and it's not easy with GD, GDV, bloat, torsion, volvulus. They're not the best letters to use. So at the minute we've got the no bloat guide with NO in red, which, you know, kind of catchy. So that's a work in progress, which hopefully we'll be able to add bits to that as and when different breed points maybe come out. There's no consensus on all the factors. We know that there's a load of stuff to be careful of, but there's no panacea here. So we must consider which in the individual breed, individual patient, which of those factors looks to be more or less useful. Okay. And the things that we can improve. So if these dogs do have chronic enteropathy, are they dogs that have diarrhea or not? Do they burp? Do they have dysbiosis? All of those things can be addressed and identified. So this is where the background diseases are really important to be able to identify, because if we can manage those, we may change the outcome entirely of these dogs developing both bloat and torsions. And so for me, like a lot of these diseases, they tend to end up being individualized for the dog. We know the generalization, but the individual case is what we then need to deal with these as. So what do we know that will help mostly? So rapid identification. We have to be able to identify these conditions. Effective stabilization before theatre, important. Not a lengthy one, but important. Shorter time to get to theatre from when the clinical signs have been first identified, and get them insured. That, I think, from a lot of these studies is very clear. And with the costs of a lot of these things at emergency clinics or referral level, it's prohibitive for a lot of people. And so make sure that insurance is something we consider. Whatever we think of insurance, it does keep these animals alive. So from some of the questions, bits and pieces here, we don't know. Rennie and Windies, no good evidence that it makes any difference. We may have problems if people use the wrong products with xylitol, because it is an insulin mimetic and can drop blood glucose in dogs. Feeding from a height, again, we don't know that that's required in some of these dogs. I've certainly had conversations with giant breed owners where the dogs that have been fed from a height have developed bloat versus those that haven't. So I think the jury's out on that. I think essentially what we're trying to do here is reduce the chances of either aerophagia or something causing a change in the way that stomach is being filled or emptied. So actually, if it does gulp its food, that's probably not good anyway. And so reducing the chances of that happening, slow feeding is more likely to be the way forward. And however we achieve slow feeding in the individual dog may be different to each other, you know, in different dogs that you're dealing with. Loads of water, not entirely sure. Same principle, isn't it? How is that stomach going to empty it? And if your stomach doesn't empty it well, it doesn't necessarily need to be water. It's anything that goes into it. Raw food, no evidence that raw food is better or worse. We're not going to get into the raw food debate tonight, but certainly there's a plate of raw food there that may look like you need to cook it. Bottom right there, do we soak the food? Certainly there's evidence of particle size and possibility of fermentation. And as we've seen from that publication earlier, where the gas that was in the stomach wasn't room air, certainly there may be some mileage in that. But I think, again, it's not going to fix all of them. All of these are possibilities that in the individual dog that may have a predisposition, it might help. So, Holy Grail, eradication. If we can, brilliant. I'm not convinced we're going to do that, certainly not in the next 5 or 10 years. But what do we need to do? We need to understand the condition better, which isn't easy. We perhaps need to understand that each breed may have specific reasons why their bloat and torsion occurs. We know that they have different traits and conditions anyway, so therefore it's not rocket science that would be the case. Should we expect one plan to address the condition in all breeds, and should we expect one plan to address the condition in all dogs? I think the answer to those is no. So what we do with all dogs that get bloat and torsions, I don't think that's going to give us a solution. We have to look at this at a much more detailed level and pick this apart accordingly. So what have we been doing? So as we said, the work with Adam's work back in 2013 showed that a lot of these dogs are dying before they even get out of the consult room. Hence, that's important to be able to address that. We've done some work with the deerhounds and greyhounds. Those things have been presented at some conferences. Deerhounds, stressful events seem to be quite robust. Greyhounds, history of abdominal surgery, so not the same between both of those breeds. So we've been using the same survey in each of these breeds to try and pick things apart. Where are we with active projects? So we've had a frustrating condition. A frustrating situation with the wolfhounds. We had a big study on this, and then the survey hoster unfortunately decided they'd delete all of our data, which, despite my protestations that they weren't interested in getting that back. So we're just re-rolling this up with the wolfhounds. So we're only 442 replies behind where we were. So that's a work in progress. German Shepherds, we've only just started literally in the last month. Leonberg's been going for a little while, but one of my students that's looking at this breed, I haven't got the breakdown with those to know which are affected and unaffected. Bloodhounds, a reasonable number. Poodles, 750. They're top of the shop at the minute. Bernese Mountain Dogs have given us a decent number. Chow Chows are doing well. The Newfies aren't too bad. St. Bernards are pretty good for being a very minority breed. Currently, breeds that have expressed an interest in being involved, the curly-coated retrievers, bloodhounds, bassets, and mastiffs, we haven't got any replies from them as yet, but those are surveys that should be open. So if we total those up, we've got nearly 1,500 dogs, of which we've got over nearly 350. So I've not pulled in the Leonbergers and the wolfhounds to that. 350 affected and just over 800 unaffected. Now that's great, but if what influences the development and outcome in the St. Bernards is different to the Poodles, is different to the German Shepherds, then that 1,429 is not a relevant number because we can lose the detail. Okay, and so that's why, for me, looking at these as individuals is really important, so we don't miss what's happening in your breed. Because for me, it's about what's happening in your breed. Because if we generalize, we start to lose the power of which of these factors makes a difference. So what's the message? So we're at the end. What's the message at the moment from all of this? I think we should be more poodle. And here's my guilty. I love these little poodle, these miniature poodles. These I'd like to have one or probably about a whole tribe of them. But again, it's for a different time. So that be more poodle. That's what I would suggest. And that's the end. Hopefully that's been a useful listening experience for everybody that's been in attendance.
Thank you, Mark. Thank you so much. We're going to do some questions now and then obviously kind of recap. There's a huge amount of detail there. And as everybody's saying, you know, it really is a huge amount to take in. Really, really valuable presentation. I'm just going to draw you right back to kind of those early signs and just to really sort of finish on, as a dog owner, how do you spot those early signs? And is there anything that you can do yourself whilst traveling to the vet? Obviously, if this happens, this is a deeply traumatic and stressful situation for anyone to be in. So what does the dog owner need to spot, and what could they do whilst they're getting to the vet?
Yeah, I think there's a couple of questions on this. I think the big challenge is if you've got a dog with gastric dilatation-volvulus, you've got a torsion, it doesn't matter what you give it, it's not getting to the stomach. So ultimately, in those cases, getting the dog to the vet as quick as you can is the one thing that we know makes a difference. So one of the challenges is trying to do stuff at home is a little bit of a distractor. And there's nothing that's likely to make a huge difference to the outcome that is better than getting there quicker. And so I would suggest that any of these signs, the trouble is if you've never had a great day or you've never had a iris setter, you're not necessarily going to know what the signs are, but the signs are something not quite right in a dog that otherwise has been fine. This isn't a chronic disease, or mostly it's not a chronic disease. So these are dogs that, depending on what you believe about, some of these dogs will be very much after feeding, they've had some exercise and it's all gone wrong. Others, there'll be absolutely nothing in that history to suggest why these dogs have suddenly developed their discomfort slightly sort of, is their abdomen seeming a little bit bloated? So the big deal here is, again, in some of these bigger dogs, you're not going to see a bloated abdomen, but it may look a bit different. The dog's unsettled. And the classic with the torsions is this non-productive vomiting. They're retching, they're trying to empty something out and they're not doing it. Now, that doesn't mean that they've got nothing to bring up. It may well mean that they can't bring anything up. So I think those are the key signs for me, is that they're unsettled or they're not quite themselves. And they are the non-productive vomiting or the retching noise, because it doesn't always look like vomiting because they're not bringing something up. People often think, they're just trying to bring up a hairball or something like that, and you end up missing that point. So for me, never err on the side of it'll probably be all right till tomorrow. These are the ones where the phone call and the trip to the vets is definitely worthwhile. You'll be happier coming home with the assurance that there's nothing going wrong than wishing you'd gone to the vets. And the challenge, I think one of the challenges is that it's so expensive. I'm a vet, and so I know what we have to charge clients. I'm a specialist, so it's even more expensive than primary care clinics. But I think it's money well spent to get to the vets. And I think, is an in-person veterinary consult better than a telemedicine consult overnight? Maybe telemedicine is better than nothing, but a physical exam in these patients is the thing that's really going to help work out how bad things are.
I think that came across really clearly in your presentation. We did have quite a lot of questions about treatments, or can you do something preemptively, and some of the medicines that you talked about in your presentation. But I think really we've left it there as, if you have any concern or any suspicion, you've just got to go to the vet as quickly as possible in this case. So brilliant. You talked a lot about breed predisposition, and we did get quite a lot of questions about which breeds are more susceptible, and can a small dog get this, can they have that too if they eat too quickly and things like that. But I think really your last couple of slides really covered off the breed predisposition, and it has to be breed specific. But I just wondered if there's anything else you wanted to say on that predisposition to leave us with.
I think, the bit about, because there was a question on small dogs, wasn't there? And it doesn't seem to affect small dogs. It doesn't seem to affect cats, and it's not really reported in other breeds. And so we think it's very much a confirmation. And small dogs don't tend to have the same conformation as bigger dogs in terms of the depth and the length that their stomach's going to be away from the body wall, for example. But I think in the smaller dogs and cats, when we've seen those animals have torsions or even bloating quite severely, that's usually that there's an underlying cause, mostly a problem disrupting the outflow of the stomach, rather than it's just a breed predisposition. So in the smaller animals, it tends not to be such a I think it's going to be a different reason than we see in the bigger dogs. And that's what I mean in terms of, so bloat and torsion, or torsion particularly, is more of a syndrome, if you like, with multiple factors rather than this is what causes a torsion. And because your stomach can twist anything, it can twist. It doesn't mean there's only one reason that it can twist. And so I think in these smaller dogs, it's a different background reason, but nevertheless the same outcome we can see, but rarely.
Great. And a related question, I know you've touched on this, but age. Is age a factor here, and are we seeing sort of a predisposition around age ranges?
I'm not sure that there's anything in the literature on that, and we certainly haven't found anything. And I think the problem with age is that, again, because torsion can be for different reasons, the sorts of things that come on with age in terms of gastrointestinal changes versus what happens in younger dogs, the anatomy is slightly, the anatomy in the younger dog is perhaps slightly different to what we see in the aged dog, and the number of gastrointestinal upsets that they might have as younger dogs versus older dogs. There are various factors that are going to be slightly different in terms of time, but I'm not convinced that we've ever seen that age is a factor that increases or reduces the risk. Going back to, if I've got an old dog and it looks a bit unsettled, well, because it's an old dog, I don't need to worry about veterinary attention because it's probably not going to be a torsion, or vice versa. I wouldn't say that age is sufficiently robust enough to decide whether or not you're going to get it.
Great, thank you for that. And just around the causes, so we've got a few questions in the Q&A and also in the pre-submitted questions about the connection between feeding and exercise, and kind of message to leave us with in terms of, I suppose everyone wants a golden solution of, how long do you leave it, and what's the advice around feed and exercise in this instance?
Yeah, I think this is the trouble, isn't there? And if you look at the literature, it does vary. And I think because you're trying to put a blanket on it, and what are you feeding and what sort of exercise are you taking? And I think for me is you just avoid it, because we know that there is a risk of taking exercise after feeding. So we would want to separate those two as far as we possibly could. And I think that is as good as I think it should be, because the trouble is, if I say, right, 2 hours after feeding, it should be fine. The next person with the Great Dane that turns up at the emergency clinic did it at 1 hour 59 and it still happened. So I think that the problem for me with a generalized statement on that is that you can then work to a time and forget the fact that what we're trying to achieve is, this is a dog who they may have differences in how quickly they empty their stomachs, and this is the thing, and that is very individual. But I would say avoid it, if you could, as much as you can. And feeding earlier, exercising later, exercising more lightly at night, those are all these things that over the years people have recommended, but I think there's still no hard and fast rules. But I would suggest that you avoided any type of extreme exercise after you've fed your dog within the last few hours. It just is too great a risk.
Brilliant, thank you for that. It gives people at least an indication there. There's quite a lot of questions as well around temperament, anxiety and stress, things that might be hard to control, but any sort of correlation or links or comments you want to make around
I think
that?
This is a big one. Yeah, I think this is a big one. This is what we found with the deerhounds, and that's why we included this in the survey. And I think we know that gastrointestinal motility, anxiety, stress levels, there's quite a big association with that. And so I think dogs that do have that sort of demeanor are at an increased risk. I think, well, we don't know if that it's in all of them, but I think there is a tendency for that to be associated. So I think reducing the stresses, and then the other risk factors, for example, a long car journey that they don't like, then taking them out for a big run round when they get wherever they're going, bad idea. So where you've got something that does seem to be poorly tolerated, reducing the chances then around that event of a torsion occurring would be very sensible. So I think I think it's something that I'm keen that we explore as more of these surveys come to sort of finish, and we can then have a look into it. But I think that the anxious dog, the gastrointestinal motility model here, I think is really quite an important one.
you for that. There was a question about the slide and the mention of nasal mites. I didn't know whether you wanted to comment any more on that. This question said, regarding my earlier question regarding nasal mites, she said it's mainly in overseas dogs. Does this extend to dogs who have been imported to the UK, or is it an environmental issue?
Yeah, well, we don't see nasal mites in the UK. They're not really indigenous. Yes, we've seen it in some of the imported dogs. I think it's been reported in non-imported dogs, but it's rare. And so if you're prophylactically treating your animals against ticks and mites, then it's a theoretical risk. But they're not going to go to the park and pick up nasal mites from a dog in the park. They just don't. They're not in the UK with any great frequency. Yes, if you're importing dogs, but then actually, as part of that importation process, they should have had a decent amount of worm and tick and flea control, and so we should have made, we should have taken care of that. But if not, if you do see them, they're reasonably treatable, and that should avoid that being a significant problem in any of the dogs we have in the UK.
Great, and we've got questions about burping and hiccuping and being prone to hiccups or burping. Are these things that start to be alarm bells for you, or things that maybe should be investigated?
Yeah, absolutely. And I think as a medic, what we tend to get a lot is that someone says, "Oh, well, that's normal for them," and you think, well, it's not normal, is it? Belching or dyspepsia, soft stools, all of these things are symptoms of abnormalities in that gastrointestinal tract. Now, it might be normal, but or considered to be normal, but it's not. If the air is not moving around in the right way, there's some reason for it. And I think in any of these dogs which burp loads or have wind or have intermittently soft stools, there is a reason in that gastrointestinal tract that may be modifiable. So that may be gastrointestinal, it may be the diet, it may be the microbiome. But I think in any of these animals that do have problems with burping, lip smacking, soft stools, that there's an opportunity there to identify a background gastrointestinal disorder that may well give a much better chance of all of that being controllable, not resolved necessarily, but controllable to the point where whatever motility issue is present, you may be able to improve that.
Brilliant. And one here, I didn't know whether you wanted to comment any more on bitches post-whelping, and whether lack of muscle, or obviously kind of any whelping after effects of bitches having large litters or anything like that, if that could play a role or it could be involved here somewhere.
Yeah, it's the classic cow with the torsion, isn't it? The LDA cow. I don't know that we've really seen enough entire females that have whelped in the studies to know that that's a big deal. But I suppose the stomach's ability to empty and move is not necessarily hugely affected by the fact that you've suddenly lost a big load of fluid and puppies from the abdomen. So actually that stomach should be able to go back, because remember, the stomach gets compressed, but it doesn't then have all of the normal activities sort of beaten out of it. So actually going back to the normal position, there shouldn't be a huge increased risk unless you've got a potential problem with it in the first place. So I think, yes, a dog that's always burped, the dog that is predisposed, that then has abdominal pressure changes, you may well see that in those cases you might have a slightly greater risk. But I don't think, again, it's not in the literature, but this is why these studies are so important, is that if we do feel as breeders, because this isn't an owner thing, and so most of the dogs that we're going to see coming through the clinics are not entire females. But if we feel in individual breeds that there's something in this, then we need to look at it, because actually it's a small cohort, but it's also a cohort that you might think, well, are we looking to prophylactically gastropexy all of the whelping bitches to make sure that they don't have any problems? Obviously, they're not being spayed, but nevertheless, a laparoscopic gastropexy, is that a good idea? And so I think this is data that if we do think that this is real, because they're going to be diluted. This is what I'm saying about the individual dog breeds. The entire females, they're just not very common by comparison to neuter females going into veterinary clinics across the world. So this is data that if we do think there's something there, great. But as it stands, there's not a huge amount of evidence that that's a risk factor.
Brilliant. Thank you for that. I mean, we're going to circle back around to finish on your surveys and your data. And obviously we're going to do everything we can from a Kennel Club perspective to really promote those and make sure people know how to participate. As part of that, we received an enormous amount of questions on feeding advice and, the types of diet, and you've covered it a lot in your presentation. We've also had questions on raised bowls and low bowls on the ground. Is there anything that you want to leave us with, particularly around feeding advice and diet, and kind of hopefully link that into the need to participate in these surveys?
Yeah, I think that there are lots of different anecdotes about what diet you should feed your dog, regardless of if we're talking about torsions or not. I think the thing I would say about diet is that what we know with various gastrointestinal conditions is that diet does play a huge role in terms of phenotype, i.e. getting, the enteropathic dog, or the dog that has subclinical inflammatory bowel disease, becomes completely subclinical on the right diet versus clinical on the wrong diet. Now, that for me is the most important bit about the diet per se, is that in those individual dogs where we think there isn't something quite right about their gastrointestinal system, we need to address that. I was going on from there, whether this is they're better on kibble, they're better on dry, they're better on tin, they're better on raw. If you speak to enough people, they'll be better on all of those. Hence the problems that we've had in the studies that we picked out with the certainly with the deerhounds and the greyhounds and the wolfhounds. When we were looking through that, there's been nothing in there that suggests the type of diet makes a difference. If we look in the literature, small bits of kibble versus slightly larger or softer foods, they tend to be more of a risk with the smaller particle size. But again, these are studies that are done years ago, where we don't have the range of types of the sort of diet that you'd sit down to eat yourself. All of these things are not tried and tested ways of feeding your dog in the literature. So it's only more recent studies that we'll be able to do on these variety or the different types of diet that you can get now that's going to make that very clear. But I suspect there is not one type of diet unless you've got gastrointestinal disease.
Brilliant. Thank you so much, Mark. This is a huge topic. It's obviously really, really important to many, many dog owners and breeds as well that really want to understand more and help people in their own breed community. You mentioned several times you've got open surveys, breed-specific surveys in this area. So what we will do is via the Kennel Club team, we will share a link to those from yourself with the participants for this evening, if we can get them the information. And obviously, if they can help share that really broadly. The webinar this evening will go onto our health YouTube series at no cost for anybody to access. So if there are people in breed communities, or if you've got friends in other breeds who could participate in the survey or might find some of this information really useful and helpful, then please do share that information with them. I want to say again, a massive thank you, Mark. It's a really, really important area. We want to continue to grow the information here and get people participating in that really, really valuable research. You can provide us feedback as well. We really want feedback on the YouTube health webinar series, and you can always email health@thekennelclub.org.uk with any comments, feedback or questions, and we're more than happy to help you. So on behalf of the Kennel Club, and also with great thanks to Mark for this evening, I'm going to draw this webinar to a close. So thank you, everybody. Good night.
Thanks. Good night.